We're clearly dealing with a time that's very different from the past as far as the coronavirus is concerned. Uh, it's a time of great anxiety for most of us, but it's also a time of great opportunity for those folks who want to separate us from our money. Con artists are using the current crisis as a way to wedge their way into your life and hopefully leave something that either you don't want, like malware, or take something such as your money. So we're going to look at a number of ways that con artists are performing these days and how they're using the coronavirus as a leaping board or a springboard to getting into your wallet. First of all, I think it's important to understand that con artists are very good at impersonating officials. Typically, it would be somebody from the Federal Health Services, a state health department employee, Homeland Security, Medicare, a variety of different government services, because that kind of lends credibility to what they're trying to do. Often when they contact you, there'll be an official premise for their contact, and to verify your identity, they will ask for things like your Social Security number, your Medicare numbers, or maybe even some other personal identifying information, or what security experts call PII. It's important that these scammers not be given any information. The contact quite often is trying to get you to pay some money as well, some kind of non-existent fee or some form of collection of taxes due, extortion payments basically. And quite often these people are even selling things such as fake or ineffective cure-alls. The FTC and the Federal Drug Administration, the FDA, have come together and they've set up some warnings and sent warning letters out to 7 sellers of unproven and misbranded products. Those are products that claim that they can either treat or prevent coronavirus. The companies produce things that include teas, essential oils, items that people would think would work well for their health. Federal Trade Commission says that the companies have no evidence to back up their claims. And in reality, there are no medications currently approved to provide a cure for coronavirus. The FDA says there are no approved vaccines or approved drugs that can end up curing you. So if you want to note these company names, it probably would be a good idea. Some of them are still advertising, even though they have been banned by the Federal Trade Commission from doing so. Vita Silver, Aromatherapy Limited, Energetics, Guru Nanda, LLC, Vivify Holistic Clinic, Herbal Amy, LLC, and The Jim Baker Show. And yes, that is the same Jim Baker who was a televangelist several years ago. If you're contacted by any of these organizations, if you receive an email or a phone call, your best bet is to contact the Federal Trade Commission, the FTC, and we'll have that number posted for you very shortly. You can also email them. So let's take a look at the scammer and what the scammer is attempting to do. Scammers really thrive on getting you into a heightened state of anxiety. And they refer to it as putting you under the ether. It's something that we all have experienced at one time or another. And the ether means raising that anxiety level however they can. It could be a matter of joy and happiness, or it could be a matter of fear. And clearly, the coronavirus threats today fit that picture quite well. There are 4 steps to self-defense. And we want to start off with those because this is not a tragic situation as far as the scammers are concerned. Most of the scams can be prevented. very easily. The first thing is, don't make decisions when you're in a heightened state. For instance, you see something that pretends to be a cure for COVID-19, the coronavirus, and you become very excited about it, and you feel, wow, this is really a good idea. It doesn't cost very much, so why don't I just go ahead and do it? That's where the problem comes in. Step back. Don't make an immediate decision, but think about what's being offered and whether the offer is truly a realistic opportunity. Ask questions before you buy. Make sure you understand what the product is and what it does and how it's been tested. Next, read about the product. Read before you buy it. Don't wait till after you buy it to find that you've bought something that won't work or that simply is not what you want. This is true for all purchases you make, but especially true when we're talking about healthcare. And finally, develop a refusal script. If you're on a phone call with someone and you really want to get away from them, obviously the easy thing you can do is just simply hang up the phone. Once you've done that, the call is ended. Most likely the caller will not be contacting you again. So let's take a few minutes now and look at the individual scams. First of all, one of the biggest scams that seems to be going around is self-inoculation, that there are people claiming to have COVID-19 immunization shots that you can purchase online or you can purchase over the phone. At present, there is no such product. Anybody who is trying to sell you one is clearly trying to scam you, trying to steal your money. Most likely, at least the smallest amount of problem would be that the person ends up getting money from you one way or another, and then you don't get anything. The worst problem would be if you send money and they send you something and it's a tainted product. So avoid those. If somebody says they have the cure, know that at this point, nobody has the cure. Second area, which is an interesting one, is maybe what some people would think of as legal scamming. And that's when a company or an organization or an individual price gouges for common items. We've seen dramatic increases in the price of many items, including face masks, sanitary wipes, sprays, that items that used to sell for between $1 and $5 are suddenly selling for $20 or $30. In fact, I've seen some of these advertisements where you spend $19.95 for the item, they'll send you one free, and they only charge you $5 for shipping and handling. The item is actually going to be sent to you, but you're going to be paying 4 or 5 or as many as 10 times the legitimate price of the item. So beware of price gougers. Know that there is no dramatic emergency right now. We've already solved the issue of what to do about masks, and know that you can make your own mask that will protect others from any cough or problem that you have. It's not that simple protecting you from the coronavirus, but it certainly is a way to help yourself. So watch out for the overt price gouging. Some other scams that we see happening quite frequently. One of them is a work-at-home or home-based business scam. This has appeared under the name of Amazon, where you're given the opportunity to start your own business with Amazon. You can earn in some of the advertisements as much as $400 a day. All you have to do in order to take advantage of this great opportunity is send some starter money. Don't do it. These are scams. You can check if it's an email by looking at the sender's address. It should be saying Amazon.com. Odds are it doesn't. And by the way, be very careful with that address, because con artists have gotten very sharp on how to deal with the return address on the emails. And instead of Amazon, AMAZON.com, they're using a variation which might show up as AMOZON or AM and then the @ ZON. So you need to be very careful at looking at who's actually sending the item. Test kits. A lot of people are still trying to be tested for coronavirus. It's slowly ramping up and more people are being able to get tested, but there are some illegal entrepreneurs who are out there trying to sell test kits that you can do at home, and then you mail in the test kit to the company. It usually includes a couple plastic bags, a swab, and a mailing instruction. The cost of these can range anywhere from $10 to $40 to $50 per test. Coronavirus testing is done by state agencies, by hospitals and other medical facilities. If it's going to be done at this point, it's going to be covered by your insurance or by the government. So anybody selling a test kit is taking advantage of the shortage of the test kits, and hopefully they think they can make some money on this. You won't get tested. You'll simply be fleeced. So be very careful on these and don't order a test kit through the mail or over the internet. And if you have any contact with people who make this offer to you or any other health product or any other medical device, be sure to report that to the state attorney general's office or the state health department. And again, we'll have phone numbers and contact information for you at the end of this program. A number of new scams have shown up lately under the guise of being a Social Security issue. The Social Security Administration does not call you, does not notify you by email. But what is happening is people are receiving emails or phone calls from the Social Security Administration, and they're saying that during these difficult times, we regret to inform you that we're suspending your Social Security payments. That certainly is going to be something that frightens a lot of people. There's how the con artist is going to bring the individual into that heightened state of anxiety, or what they call the ether. Quite often, these notices will say you have 24 hours before your Social Security benefits are suspended. You're given a contact number, and when you make that contact, they're going to ask you to make a payment, or they may be just simply collecting information. They'll say, we're just trying to verify your Social Security number, or they may say that we need some additional information. This is called phishing. It's an opportunity on their part to get your information that can be used later. So if you're contacted by anybody claiming to be the Social Security Administration, contact the real Social Security Administration. The email address is ssa.gov, but they also have offices in all states, including Vermont. The office in Vermont is located in Rutland, and you can call that office and they can verify any contacts, but they should also be told that there was an attempt to commit a crime. One of the, I guess, tried but true scams that we've seen over the past few years is something we refer to as the grandparent or grandchild scam. In this case, it's a little different than what we've seen for the most part. In the past, the grandparent scam is one where grandparent will receive a muffled call from a grandchild. And it goes something like this. Grandma, I'm in jail in Montreal and I need some help, please. Now, It's kind of hard to distinguish the voice, but most people receive the call say, it really sounded like my grandchild. So the new variation of this call is, Grandma, I'm in a hospital and I need some money to be able to pay for the treatments. Typically, the grandparents who fall victim to this have a very open heart to their grandchild. They don't ask enough questions. They don't even ask something like, well, what are your parents doing? Instead, they send money. And the usual request for money on these scams is to send gift cards or iTunes cards. The con artist will ask you to go buy the cards, come back to the phone, and then read the numbers, including the passcode from the back of the card. Know that hospitals, government agencies, most American companies, in fact, I'll say all American companies, do not accept gift cards in payment for money owed. So anytime you hear the gift card line, you can be pretty sure that that's a scam, and your best thing to do is simply hang up. Hopefully, you don't give that person any information. We find that a lot of grandparents do something like this. They get the call and they think it's their grandchild, and then they say something like, is that you, Jimmy? Or is that you, Sarah? And now the con artist has the name of the grandchild as well as your name. So the less you say, the better off you are with the grandparent scam. And in this case, the grandparent scam is working just as well as it did with the I'm in jail line that was being used before. Another new scam that seems to be rising in frequency is what we call the errand scam. An errand scam is where someone volunteers to do errands for you. They may volunteer just to do them, or they may say, for a small fee, I will, for example, pick up your groceries, prescription meds, run errands for you. If you don't know the individual, it would be best not to engage them in any practice like that. What we've seen nationally is individuals who play the role of Good Samaritan to try and help someone. In reality, what they're doing is stealing from the person who either gave them an order to buy, or asked them to pick something up, or gave them money to make a purchase. Quite often, if it's money, the money goes, the person goes, and nothing ever comes back. If it's picking up groceries or other items, the person will pick those things up and then not return with them. So if you need to have errands run, there are organizations that do that in every community. There are also neighbors that you might be able to ask, but certainly don't rely on a stranger, as that may end up costing you in whatever money you're putting on the line at that point. During this particular time of crisis in the country, a lot of people aren't shopping in their traditional ways. They're making purchases online, even from grocery stores, and picking up the items or having them delivered. More and more Americans are turning to online purchasing, and that's becoming a problem in many communities. The online purchasing should be done from known vendors, but quite often people are going to organizations or companies or individuals who they've never done business with before. They see a very slick advertisement, something that has eye-catching quality to it. It may also have a very good price attached to the items being sold, and as a result, anybody might very quickly say, and buy from them. Safety is something they have to consider, and when making online purchases, that's always going to be true. With more and more people making online purchases, the best practice is for you to use well-known and safe vendors. A safe vendor typically is someone who's done business in your country for several years. Finding a new business and doing your shopping with that business may end up creating problems. If you decide you're still going to go ahead and make a purchase online from a company you haven't dealt with before, at least check with the Attorney General's office or the Better Business Bureau to see if there's some complaints lodged on that company. If there are, you have a certain signal that will tell you, don't buy from these people. Otherwise, you feel it's worth taking a chance and there are no negative reports, odds are that you'll be making a good decision. But again, be wary of vendors that you have not done business with or that you've never heard of. Malicious emails are starting to show up, as well as malicious phone calls. If the average citizen in the country has a lot of time on their hands, then a lot of the con artists and criminals out there also have a lot of time on their hands. And what we've seen is a major uptick in the number of malicious notices, social media notices, emails, text messages. A malicious email, text message, or phone call will either have something in it that identifies racism or sexuality or some other behavior that we don't normally feel is consistent with good citizenship. If you receive an email that has that kind of message in it, delete the email. If you receive it a second time from the same source, then you want to report that email to your internet service provider. If you get a text message or a phone call from a company or an individual, the best bet to take is hang up, don't respond. If that call keeps coming or that message keeps coming to you, report it to your service provider as you would with the internet service provider, but here with whoever is providing you with phone service. The call can be blocked. You can block it yourself in many cases, or you can notify your provider and they might be willing to put in a system-wide block and protect others from the messages. I'm going to give you a series of specific scams that have been coming through as emails. The first one is what we'll call the consumer relief package email. In this email, someone impersonates an official and an official website attempting to get the intended victims to donate or provide information and possibly even to provide payment or donations. There's a link in the email that allows you as the reader to download. That download often has malware on it, which will infect your computer. At best, it's an annoyance. At worst, it's designed to root out identity information from your computer, including credit card numbers and other identifying items, and then send them back to the person who had that installed on your computer. The best bet is if you receive an email from a major organization, and here our example is from the World Health Organization, WHO, make sure that that email is actually coming from the WHO. It should have their identity in the return address. If it doesn't, then you know that it's a scam immediately. If that email continues to come, notify your internet service provider and let them handle the problem by blocking that organization that's sending out the malicious emails. Quite often, people will also pose as help desk support. With the help desk support, the email will say something to the effect that we know that in these hard times, trying to get technical support from your employer is very difficult. We're here to help you. Many people have been falling victim to this scam because being home, basically home alone, and without technical support to lean on when they need it, they will turn to these rogue organizations and think that they're going to get the tech support that they need. That's happening because more and more people are working from home on their computers, and it's making a new audience for the con artist. So you want to be very careful, and if you're going to get tech support, make sure the tech support is from a verifiable organization. Another thing we're seeing a lot of are fake charity or fake donation scams. These are coming through fast and furious, as they do whenever there's a national crisis or even a local crisis. An example would be when the state of Vermont experienced Tropical Storm Irene many years ago. Suddenly, charities began to arise to help almost anybody in need, even people who weren't in need. And quite a few of those charities were not legitimate. The best thing to do when approached by a charity for a donation is, if you're serious about making a donation, first thing to do, check them out. There are a number of places that you can verify the identity of a charity. We're providing you with a list of those at the end of this program. As a result, you can protect yourself. Another way that you can protect yourself is make your donations to local organizations or to well-known charities. That way, you'll know that you're making a donation to someone who really appreciates it and someone who will do well with that donation. Even so, I would recommend that you check out that source and see if the donation really is, if the donation will really go for the charity and for the work that you would like done. Those are our tips today for scams. There are quite a few of them. We've given you some very specific examples too of how to be able to spot the scam, also what's happening in the neighborhood of scams. If you have a new one that you want to report, by all means, please send me an email. My email address is egreenblott@aarp.org, and I will respond to you, and your concern or your question or the scam that you reference may very well show up on the next program. So thank you for watching, and be safe.